At Skyland Trail, we collect data on all of our patients at the beginning of treatment, at the end of treatment, and all throughout treatment. This is really important to a model called measurement-based care. And measurement-based care has shown to be effective in getting patients better faster, and keeping them engaged in treatment. This data is fed back to the patient's clinical team in conjunction with the patient so that we can get a really good idea of what our clinical targets are and how people are doing as they proceed through treatment. So if you're in treatment and you're doing really well and you get stuck, we can use that data with your treatment team to figure out where the stuck point might be and develop targets from that so that we can quickly get you feeling unstuck. In our adolescent program, we collect fidelity ratings for our dialectical behavior therapy, or DBT, treatment. What this means is that every month we have our clinicians rated on how closely they stick to the DBT model of care. What this means is that we can say that when we're doing DBT, we know we're giving you DBT at the dose and strength it was designed to do. In our last year, we had our clinicians end up meeting 90% fidelity, which is a higher standard than most clinical trials. So we know that while every clinician, no matter how good, has some drift from evidence-based care models, fidelity is a way to make sure that we are monitoring that drift and bringing people back to give them quality psychotherapy so that when you send your loved one to Skyland Trail, we know that you're going to get the highest quality DBT treatment that we can possibly give you. We implemented prolonged exposure therapy, or PE, in our adolescent program for patients coming in with comorbid PTSD. We did this in a really rigorous way in partnership with the Emory Healthcare Veterans Program, where all of our PE-trained clinicians went through a rigorous training in 6 months of consulted case review. So each session was reviewed with a consultant for 6 months. And we found that 86% of the patients coming in with PTSD who did PE had a clinically meaningful response. A clinically meaningful response is one that science shows us is more than just numbers. It is a drop that patients feel and leads to change. And our patients did this while they were still getting CBT or DBT for their primary diagnosis. So we showed that we can treat the effects of PTSD while also doing our normal treatments for any patient that comes in. In recent data that we presented at the Society for Biological Psychiatry, we looked at our adult depression program, including our residential program and our transcranial magnetic stimulation, or TMS, program for depression. What we saw is that using the data we collect on patients, treatment teams refer patients to TMS who have higher scores than our average depression patient coming in. And what we see is that the patients who get the TMS, in addition to our residential programming, have the same score when they leave treatment. So we are able to get them to decrease from that higher place to the place where we would see other people leave. So we can use data, we can use the tools at our disposal to customize a treatment plan so that we can get even the most severe depression cases to improve as we would expect everyone to.